Welcome to the Vet and Crit Academy, where we discuss veterinary emergency and critical care and science-based tools for vet professionals. Hey everyone, here's what you'll learn by the end of this video. Did inpatient care for lily exposed cats prove to be more effective than outpatient treatment with subcutaneous fluids? This study looked at how inpatient care compares to outpatient treatment in cats exposed to toxic lilies, focusing on how each approach affects kidney injury and survival rates. As we all know, lily toxicosis in cats is a veterinary emergency that can cause acute kidney injury, or AKI, within 24 to 48 hours of exposure. The standard treatment includes rapid decontamination, hospitalization, IV fluid therapy, and renal values monitoring. However, financial or logistical constraints sometimes lead to outpatient management with subcutaneous fluids and daily rechecks. This study sought to determine how these two approaches compare in preventing AKI and improving survival. The study retrospectively analyzed medical records of 112 cats with lily exposure. Researchers tracked AKI prevalence, changes in kidney function, and survival rates for cats treated as inpatient versus outpatient. AKI severity was graded using the IRIS AKI criteria, and treatment details were recorded. They found that AKI occurred in 46.9% of inpatient cats versus 43.8% of outpatient cats, which was not statistically different. By the way, you can watch a completely free workshop on acid-base analysis and register for a free RACE-approved course on intravenous potassium supplementation by clicking on the link below located in the description. All right, let's start with the inpatient group first. In this group, just over half the cats, about 53%, did not develop any signs of acute kidney injury or AKI. Around 18% of the cats had a mild AKI grade 1, but 28% had a moderate AKI grade 2, and only one cat, less than 2%, had a more severe AKI grade 3. Now, for the outpatient group, a similar proportion of 56% did not develop AKI. However, 19% of these cats had an AKI grade 1, and 25% had an AKI grade 2. Unlike the inpatient group, none of the cats in the outpatient group developed severe AKI, grade 3 or higher. Interestingly, the overall AKI prevalence in this study in both groups was higher than in previous reports. This is likely because the researchers used the IRIS AKI criteria, which are better at catching mild cases. These criteria can detect even small increases in creatinine, more than 0.3 milligram per deciliter from baseline, even if the creatinine levels are still within the normal range. So it's possible earlier studies simply missed some of these milder cases. What about survival? None of the cats in the inpatient group died, so that was 100% survival, whereas 2 of 16 cats in the outpatient group were euthanized, which translates to about 87.5% survival. This difference in mortality was statistically significant with a p-value of 0.02. Before you jump to conclusions, it is important to mention why these 2 cats in the outpatient group were euthanized. According to the authors, both euthanized cats had a grade 2 AKI, with maximum creatinine of 2.1 and 1.8 milligram per deciliter respectively, as well as persistent clinical signs of lethargy and anorexia and vomiting. The exact reasons why these 2 cats were humanely euthanized aren't entirely clear from this study. It's likely that financial constraints played a significant role in the owner's decisions. What's important to note is that if these 2 cases were removed from the analysis, there wouldn't be any statistical difference in overall mortality rates between the inpatient and outpatient groups. Honestly, I'd interpret these specific results with a big grain of salt, as they may not fully reflect the effectiveness of the treatment strategies themselves. So, what are our main takeaways? First, it is crucial to understand that the study's retrospective design and small sample of outpatient CAT scan may limit its definitive clinical significance. Additionally, the inclusion of cats with only suspected and not confirmed Lily exposures could have underestimated the AKI prevalence. On the other hand, the study found a higher prevalence of mild to moderate AKI in both groups of cats as compared to previous reports of cats exposed to toxic lilies, and the overall survival rate remained excellent. It's important to note that this study does not provide enough evidence to make a definitive recommendation on the best treatment approach, whether that's hospitalization with IV fluids or outpatient care with subcutaneous fluids. However, the results are still encouraging, as none of the cats in the outpatient group developed severe AKI that would require something as intensive as renal replacement therapy. As always, larger, well-designed prospective trials are needed to confirm these findings and help establish evidence-based treatment guidelines for cases like these. If you want to learn more, check out our video on blood gas analysis during CPR.